So shoulder instability is a mixed bag as well. It's really all over the board sometimes with people's response to the shoulder surgery to stabilize it. And some of it has to do with how young you are, how long the dislocations have been occurring, how many that you've had, what's the type of procedure that you had performed, because there's more than one for shoulder instability. And the real tricky part is you can develop arthritis in your shoulder, unfortunately, if you've had a long history of instability, as well as multiple dislocations, and you're a little older, like, above 30 to 40 years old. If you've been dislocating for 10 to 15 years, the cartilage, unfortunately, can wear out. So even though you've stabilized the shoulder, that arthritic condition will continue to progress. And with that kind of question that he's asking or she's asking, I would anticipate that'd be my biggest concern, is that you've developed arthritis that's now causing your pain rather than the instability. So you shouldn't continue to have pain after the shoulder's been stabilized if everything's going correctly. Stiffness after shoulder instability surgery is fairly common. There's a balance between stability and motion in the shoulder that you're always playing with as a surgeon, and you can't stabilize the shoulder without sacrificing a little bit of motion. And sometimes the scarring that does occur can be a little excessive, and that will lead to stiffness, but it generally doesn't always cause pain. So to that viewer or that question writer, I would suggest that you go in and get it re-examined in an x-ray. Hopefully there's not any arthritis that's progressing, but it sounds kind of like that's maybe what's happening to you.